Hello everybody, how you doing? I hope you're doing fantastic. Well, today is the 2nd of March 2016 and it marks my 1 year anniversary of the hair transplant that drastically changed my life. And today I just want to share my story, my journey up to this point, and I want to show some before and after pics of my surgery and just to help other people and talk about it really. Now, I'm well aware that this video isn't going to appeal to everybody specifically, but I think you'll find it informative and interesting anyway if you just stop by and watch. First things first, I just want to say how happy I am at this moment in time. It's completely changed my life. I'm on top of the world. I've got all my self-esteem, confidence. I'm not depressed, anxious, not even any of them things at the minute. I'm just concentrated on what I've always wanted to do in life, and I'm in a really good place at the minute. And I couldn't be happier, honestly. It's changed my life so much. So just a bit of a disclaimer, I am going to show some surgery pics. So if you're a little bit squeamish, you might want to not watch it or turn away at those moments. Why do we even go bald? It's not fair, is it? Well, basically it's down to hormones and genetics. Hormones control which state our body's in, and genetics is hereditary characteristics we inherit. What causes baldness is, to keep it in simple terms, 5% of our body's testosterone gets turned into a chemical called dihydrotestosterone, which is commonly known as DHT. And it's this chemical DHT which is 5 times more potent than testosterone, which affects certain hair follicles in our heads, dependent on our genetics. The chemical DHT, it affects the hair follicle in the way it grows, and it slowly miniaturizes the hair follicle, which produces a thinner and thinner hair over time until it closes up and doesn't produce a hair at all. So lads, if you're on the roids, this increases the amount of testosterone in your body and also the amount of DHT which is produced, so it's just something to bear in mind, that's all. I just want to mention that this hair at the back of the head is genetically programmed never to be affected by hair loss or the chemical DHT. That's why you always see like men with full hair at the back, even fully bald men, you always see like the horseshoe at the back of the head, because this hair is programmed, genetically not to be affected. Now, there are 2 main hair transplantation methods of today, and those are FUT, which stands for follicular unit transplantation, also known as the strip method, and then there's FUE, which stands for follicular unit extraction. Now, the only difference between these 2 procedures is the way in which the hair is harvested from the scalp. In FUT, a small or large strip of skin is cut out of the back of the donor area. It's then passed on to other workers, which then carefully dissect each follicle under microscope. The remaining wound at the back of the head is then closed up with what should be a technique called the trichophilic closure. I'll go into detail in that in a little bit more. In FUE, what's typically used is a 0.9mm circular punch, and then that's punched around the hair follicle at the back of the head, and then the graft is removed from the scalp and rest aside, ready for transplantation. I should just quickly mention that when the hair follicles are dissected into singular grafts, each follicle can contain up to 5 hairs in one follicle. Didn't know that, did you? I didn't know that, but now I do. And now you do. Now, I've had both these procedures, so I am qualified to give my opinion on both of them. In 2009, I was receding really badly at my temples. Here's a picture of my temples at that point. So I decided to go to Belgium and get some FUE work done. A year after that, I wasn't really impressed with my results. I think I made a bit of a rash decision, and price point was more of an issue than getting the actual job done I needed. My hairline wasn't as I wanted it. They designed it, and the density that they packed the grafts in, it wasn't sufficient enough. Also, on top of that, I lost a lot of grafts due to them dying, which I'll explain in a minute. So it just looked unnatural, and it just didn't look right, and I wasn't happy with it really. I mean, it wasn't a complete disaster. I mean, there was still hair there, but what happens with FUE, I'll go into this now, and I only researched this a little bit more after they had the operation, because I kept seeing hairs dying and like hairs coming through and they weren't right, they were dying and falling out and malfunctioning compared to the other healthy hairs, which were fine. You see, what happens with FUE when it's done manually is it's a bit of a blind technique, as you can't see underneath the skin. So when you're punching around the follicle, it can be damaged, and I'll put a diagram up. The damage is called transection. It's where you actually damage the hair as you're taking it out. Also in FUE, I think the hair goes through a lot more trauma when it's harvested from the scalp, because it's punched around. It can be exposed to transection. Also, it's pulled out of the scalp, you know, and I think it goes through a lot more trauma being pulled away from the scalp. Whereas in FUT, it's carefully cut under microscope from the side, so the workers can see exactly where they need to cut, and that's a massive advantage. And I think this is the reason why the survival rates are a lot higher in FUT work compared to FUE. In FUE, the survival rates are around 75%. So if you have 1,000 grafts, around 25% of them are going to die or risk transection. It is reduced in robotic FUE, but that's a lot more expensive if you want to go that route. Whereas in FUT work, because the grafts can be clearly seen under microscope and cut round carefully without transection, the survival rates are in the high 90% range. So after that procedure, I wasn't really happy. I'd kind of just got on with life as it was then. So fast forward to 2015, and my hair was in a real bad state. My crown had just disappeared altogether. I'll try and put some pictures up now. And I was just really in a dark place with myself. It's sad to think, innit? I mean, how can hair affect you so much? But it can, it really can. It can affect your self-esteem and self-confidence. And some people aren't bothered by it, and you know, it's up to them, isn't it? But I think those people, if you ask the question, would you rather have a nice head of hair or would you rather be bald? I think they'd choose the nice head of hair every time. But everybody's different, and not everybody is affected. But when you are affected by hair loss, it's quite a serious issue, and millions of other people are affected by it. It's just a silent epidemic. People want to maintain this macho image. They don't want to let the guard down, and it's a bit silly, isn't it, really? It's nothing to be ashamed of. I know people have hair transplants and they don't want to tell anybody, but it's up to them. It's up to each individual. I'm telling you about it because I want to help other people. I was in a real bad state in 2015. My self-esteem and self-confidence was sub-zero, which also led to feelings of worthlessness, and that leads on to depression. I was in a real dark hole and dark place. So out of desperation, I had to book another operation and did more research, and in total I've done like 7 or 8 years research, and decided that I needed to go with FUT because I needed to move a lot of hair. That's another thing about FUE compared to FUT, is FUE procedures predominantly used for small jobs, you know, filling in temples, you know, of up to like 1,500 grafts and something like that, whereas FUT is used for moving a lot of hair. So I knew I needed to go down that route. I knew I needed to move a lot of hair because all my crown had gone. I wanted my frontal hair line redesigning to what I wanted it. I decided to go with a doctor called Dr. Damkern Pathomvanich, and he's an amazing surgeon in Bangkok, Thailand. This decision turned out to be the best decision I made in my life so far. And one of the main reasons I chose Dr. Damkern is he was renowned for his trichophytic closure. And I mentioned that earlier on, didn't I? I touched on that. Now, what happens with a trichophytic closure technique is when the skin is removed from the back of the head, the open wound, one of the edges of the skin is trimmed all the way across at a 45-degree angle, which I'll show in the diagram. Just trimming off the tip of the hair, not damaging the follicle. And then when it's sewn together, this enables the new hairs to grow through the scar in the healing process. It's absolutely fascinating, isn't it? So Dr. Path, which he's also known by, specialised in this closure technique, and he was renowned for it. On top of that, he's got like 20 years plus in the industry of hair transplantation. Also, he won the Golden Follicle Award in 2010, which is such a prestigious award in the hair transplant industry. It's unbelievable. So my decision was already made, and I wasn't even worried about it, to tell you the truth. Before I went, I knew I had to get through it, and it was just a case of getting past everything. I wasn't scared of the operation. I wasn't scared of Dr. Path. I knew I was going to get good results, and it was all down to research Another doctor I'll also mention, which is renowned for a good closure technique, is Dr. Feller in New York City. He's also an amazing surgeon. I knew I was in good hands in Thailand with Dr. Path, and I did actually make a vlog about it. I stayed there for 3 weeks, and my girlfriend at the time, she really looked after me and did everything for me. She was amazing, so I thank Kanisanan a lot for what she did for me over in Thailand. On the day of the procedure, I arrived at around 7 o'clock in the morning. I then did a HIV blood test, which came back negative, and if it's positive, you can't go through with the operation. It's just a safety measure kind of thing, because you're having blood work done and there's lots of blood everywhere, so they need to do a HIV test. So as soon as that was all clear, I was straight into the operating theatre. I took some tablets to kind of ease the pain. There was a bits of pain here and there, but nothing really drastic, you know. Here's some pictures straight after the operation, so if you want to turn away now, you can do. Quite shocking them, aren't they? So yeah, I look like Krusty the Clown or something, but it's what I had to go through. I'm not really bothered. And here's a picture of the scar, which went all the way around my head, which is unbelievable, but he did it so neat and it was so delicate, and I've just made up with it. It was a long recovery compared to FUE. FUE, you're looking around a week and then you're back to normal, you can go to work, but this was like 2-4 months before I could do any strenuous work or exercise. But it was all worth it in the end. Now I'm going to show you the after pics, and just how happy and proud I am of my hair now. It's unbelievable. I don't even think about it, but here are the after pics, and I'm going to show a little video as well, just to show you the scar in the way it healed, and see if you can see. I mean, I've got a number 3 clippers around the back here, because I like my hair short, and that was one of my fears originally in the beginning. You know, nobody wants a big scar in the back of the head, and that's what I think the FUE guys promote, you know, that their surgery is a scarless surgery, when it isn't at all. There's no such thing as a scarless procedure. Either you have your small circles in the back of the head dotted all over your head, or you have the linear scar. It's up to you what you do. Whichever you go for. Note that FUE is for smaller jobs and FUT is for bigger jobs. You know, bear that in mind. Bear the survival rates in mind. FUE, you're looking at 75%, like I explained before, because of transection, and it's a bit of a blind technique when they're taking the grafts out, whereas it's much higher in FUT because they can see everything more clearly under microscope, and the survival rates are in the high 90s percentage. But like I say, it's a longer recovery period with FUT, but let me tell you, it's worth it. Just to add another thing about the whole process and what to expect, when you have your hair transplanted from the back to the recipient area, when these hairs which are in the follicle are moved into the recipient area, what happens is within a week they will just shed out of the follicle, and then that's when the new hair starts to produce itself, and then that's when your hair will produce a thicker and thicker hair until, like, at the year mark, you'll get the full effect. You know, in the beginning you might produce like a thin hair, and then it will shed and then produce a thicker hair. It's like the opposite of what happens when the chemical DHT affects a hair follicle. It's the opposite of that when you get your transplanted hair. What funnily enough happened in my case with Dr. Path is, in my temple area, the hair did shed and then it began to regrow as normal, but actually all the hairs in my crown area, they just grew. They grew as normal. This is really rare in the industry, and I'm very fortunate that it happened, but only 2% of patients' hair grow straight from the get-go, because normally, like I said, it all just sheds out and then regrows from there. But in my crown, for some reason, whether it's to do with the doctor or something, I don't know, he's a genius, it just continued to grow. I've got all my self-esteem, self-confidence back. I've started doing the things I always wanted to do in life. I'm making bold decisions. I'm putting myself in situations that I could only dream of. And I'm really on top of the world, enjoying life so much. I'm not where I want to be financially, but I will be soon. And I believe in myself. And it's just moving forward from this point on. Just a quick note for all those people that think hair transplant is a vanity thing. let me just explain to you and address that right now. Wayne Rooney had a hair transplant. Do you remember that? You just call Wayne Rooney vain. Now how stupid you feel. People have made some horrific comments on my last video I did about me being vain and how preposterous it is for vanity, my own vanity, to cause depression, when I think it's just a case of people would associate me as a decent looking lad, so if I have an operation like a hair transplant, I'm vain. Whereas if Wayne Rooney does it, he's not vain, you know, because he's associated with Shrek. And it's just different, innit? You know, people are strange, aren't they? But people are going to judge. They're entitled to their opinion. These people that are closed-minded, they don't have an open mind. They're not empathetic about others. They're in a bad place themselves. So let them think whatever they want to think. Anyway, I know what the deal is, and that's all that matters. So that's why I'm passing this information on to anybody out there who's thinking of getting a hair transplant. I'll come with you. I'll hold your hand as long as you pay for me. I'll help you through the process. Ask me any questions. All my information is down in the description box. Now I'll just say that I've got nothing at all in my hair. There is no concealer or anything like that. So yeah, I'm made up with it. Absolutely made up. But yeah, there's absolutely no concealer whatsoever, because you can buy concealer. So yeah, and I've just washed it. So there you go. That's my hair. Thanks very much for watching this video. I know it's been a bit of a long one, but I hope you found it informative, and I hope it can help somebody out there. And if Dr. Path's watching right now, here's a virtual hug from me, Dr. Path. Thank you very much. I'll be coming to see you very soon, just for a checkup. I'll see you all in the next video. Bye. Yes, 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 yes. Woo!